Hi, I'm Amanda Weekly, and this is my capstone paper, and it is on lacking holistic healthcare accessibility in low income and high crime communities. So, with this topic, some background: the World Health Organization was founded in 1948, and then in current modern day 2026, we still have individuals in the United States who are unable to access, utilize, or understand their healthcare needs. So it may not be all of those factors at the same time impacting a person's ability to receive good care, but specifically in low income and high crime communities, we find that they are having an exacerbation of the issues that the general public experiences with healthcare accessibility. A lack of adequate health care directly impacts the communities that we live in. And that is not just a problem here in the US, but we find it in other studies anywhere in the world. Low income and high crime communities are more likely to experience health disparities. So, be it in the access of the care that they receive, but it also can be found simply in the conditions that we find. They are significantly higher risk for certain health conditions, the majority of them preventable. So the purpose of my study here is to explore the barriers to holistic healthcare, holistic being the complete, physical, mental, psychological, and spiritual types of healthcare. And the lack of that in low income, high crime communities, and then to discuss the strategies to improve healthcare accessibility and utilization to improve and sustain the overall quality of life. So, for my literature review, there was a study done on feelings of safety during daytime walking. So, this is not actual safety, but perceived safety, because perception is reality, as the phrase goes. And so whether there have been real issues is irrelevant. It's if a person perceives that they are unsafe. So in low-income neighborhoods, they have disproportionately high rates of obesity, type 2 diabetes, and cardiometabolic conditions. So anytime people have those, we're looking at the physical health. So if people do not feel safe to walk during the day in the place that they live, that not only is impacting their mentation, so they're having fear, anxiety about walking, but it's the physical health, because now we're avoiding those things. Both stress and inactivity can lead to downstream inflammatory changes that alter body composition, and then the metabolic and immune functions that lead to chronic conditions. So not walking enough and being anxious or worried about things is directly impacting the physical health of people in this community. And then research is showing that neighborhood effects on health and behaviors can be more pronounced in low income as compared to wealthier neighborhoods. So a lot of the studies that were being done were showing a more affluent neighborhood. And so although there were still impacts to individuals because of the stress that they would experience, it is disproportionate in a low income neighborhood. When you do those same studies and look at the same factors, the perceived unsafety of the environment has a more significant impact when they are low income than when they're affluent. So in another study, we looked at family voices and actually talking to families and getting them involved in the healthcare, reporting of the healthcare, talking about the experiences that they were having. So the National Child and Adolescent Health Measurement Initiative, CAMI, it's a public-private coalition, and they came about really to help families be in the center of the care they're receiving. They wanted to survey what was happening, what are the barriers, what's going on, to really improve the services people are receiving. In this, they've had decades now of use, but there are misconceptions that they found. Really, one of the big issues was that children are not little adults. And the reality is that they are developing. They're dependent on family members, and we really have to be sensitive to the care they're receiving and understand how to both assist the child in healthcare and the parents, because one is influencing and impacting the other one and is a decision maker, but the impact it has on the actual patient, being the child in a lot of these situations, is very different. And so really just taking a step back and giving a better foundation to healthcare providers and people involved in the care of children to understand that there are long-term implications physically, socially, mentally, on how this experience goes for if they will seek healthcare and the type of healthcare that they'll have later. There's been issues with Medicaid, so like government-funded programs and private insurances, to really implement and optimize family-reported measures. So we were getting great information, surveys were being done, but ultimately nobody was responding to what families were reporting. So at that point, we're getting great information about what the barriers are, what the issues are in healthcare for families who are trying to receive services, but there's no implementation of it, which really makes the information useless. If we have great information and we're not using it, nobody benefits. It's just wasted data. And then we need to address childhood trauma in society to ensure services prevent and mitigate sources of toxic stress. So, unfortunately, trauma is a real thing. It's a buzzword in a lot of places right now, but there are real traumas and experiences that people have, and how we manage them, how we support them during, after, and long term really impacts their physical health and how they view healthcare overall. And so we really have to take that serious, especially when you're dealing with small children. So you're coming across these things, you're in a position to really help rewrite the narrative of those experiences. And if we don't take that seriously, it has a poor outcome for the child, but also for their future family. And it's just a cyclic issue. Then also, healthcare access and deprivation in low-income households was another study that I looked at. So this really looked at South Africa, at a community there. And so 80% of that population relies on public health care. So it's either due to income issues or unemployment. Low-income households are more likely to have limited access to care. So the barriers, we have to look at those questions. And so they did look into what were the barriers. And one of the things they found in this study was showing really that it wasn't just a difficulty having the care, it's also that the care is subpar. And so people might know that it's available, but if I have concerns for the actual competence and efficacy of the care that I'm receiving, I may not seek that out at all. And then a fourth literature that I looked at, it looks at barriers to health equity in the United States and can they be overcome. So roughly 78 years after the formation of the World Health Organization, it's arguable how much progress society has actually made in achieving health equity. It's discouraging to hear a statement like that. There are so many good things that are happening, and I'm very passionate about healthcare as a nurse, but there is so much more we need to do, and there are still very simple barriers, things that if we really look at them, we could start getting making progress in these areas, but we have to take it serious. And those impediments to health equity, they continue to be pervasive and should be addressed. Contributing factors. So a group of barriers was discovered through this research. So information sharing, racism and biases, lack of appointments, technical literacy, communication gaps, social determinants, out-of-pocket costs, and insurance coverage are all barriers to individuals receiving adequate health care. And it is the inequitable access to health care that is one of the most fundamentally pressing issues facing society. Some people have great access, some people have almost no access. And so, especially when we're looking at low income and high crime communities, people don't want to establish facilities there. There's the issue with transportation. There's also funding. There's just a lot of things that come into that. But every individual should have the right to safe, competent, compassionate health care. And so, in one of the studies that looked at providers, it was surveyed about a little bit more than 1,000 providers, and it really looked at impacts that insurance can have on the care that people receive. And so, of these providers, 94 of them reported that there were delays in care caused simply by prior authorizations. So, insurance companies saying that you can't get this without us saying so, and 94% of the providers had experienced opportunities where insurance companies were delaying care. So, out of the delayed care experiences, 75% of the providers reported that there was treatment abandonment, meaning that whatever they had recommended or prescribed as appropriate treatment could not be completed or finished due to insurance issues. And then sadly, out of over 1,000 providers, 33% of them reported that in situations of abandonment due to lack of insurance approval, there were severe consequences for the patient, including hospitalizations and even death. So we're talking about people getting care, we're removing barriers. If we're looking at a prior authorization, the patient has made it to the healthcare facility, they have had appointments, they have sought the care, and they're trying to follow through. And it's kind of this unknown third party that is impacting their ability, even to the point of causing hospitalizations and death, which ultimately is a whole other issue because we're causing additional costs and strain on the healthcare system. Other contributing factors is a lack of perceived safety, and that can directly impact the decisions to make and attend appointments. So when we were looking at the study, looking at the perceived safety of walking during the daytime, there are conditions in the neighborhood that would affect a person's ability to feel safe. So even something as simple as an empty lot that cause some feelings of unsafety for people. And so making adjustments in these neighborhood communities can have a huge impact, because in places that are low income and high crime, that have blights and abandoned lots, things like that, we see pervasive obesity, type 2 diabetes, and cardiometabolic health issues. And then there have been plenty of studies on blue zones. And so looking at that in contrast to the issues that we're finding in low income communities, there have been numerous studies that show that walking and physical activity, in addition to other lifestyle factors, plays a significant impact on that health and longevity in blue zones. And then the research of the Child and Adolescent Health Measurement Initiative, CAMI, found that there's persistent inaction across most states and local healthcare systems to prioritize child healthcare quality measurements, engage families in the care, and to integrate the family data. So we're asking people for responses on what's going on. They are giving us feedback on firsthand experiences, but the insurance companies do not want to use that. And unfortunately, persistent inaction on that information. And then again, in almost 78 years of the World Health Organization, there have been almost no significant changes to health equity. And we know so much. We are in the information age. And so to have direct feedback, to be able to stratify that and quantify it and translate that data into responses, and then to choose not to, the only question really is why. And then we have to look at the fact that if somebody is unable to access health care, however reputable it would be, they can't benefit from its existence. So even if we did have top tier, best care in these low income communities, if the people cannot access the care, be it due to out of pocket costs, insurance, prior authorizations, transportation issues, it cannot serve them. And so when they look at that study at South Africa, it wasn't just the accessibility of the facility, but then the quality of the care that was causing people to not utilize it. And so some of the issues that they found were that because it is a low income area, they're generally operating with less resources, including human capital. And so less people working, less pay. So as far as like prior authorizations, you don't have somebody available to just do prior authorization phone calls all day long and to follow up on denial letters or things like that. Those people were generally providing care, and so there were lots of things that kind of had to be triaged for their acuity, and if it was not of high importance, it just couldn't be done right now. And that, ultimately those people are falling through the cracks, and that's because income is directly impacting the resources available. So some strategies and recommendations that we found. The perception of safety in one's neighborhood has a significant influence on mental health and obesity, even after accounting for recorded crime. And so things like those blighted lots, empty spaces, changing the landscape of that. Create a space that looks cared for, that looks like somebody is invested in it, and use those spaces to help create a sense of interest, and protection, provision. When people start seeing that, that's going to alter how safe they feel. Also, do additional research. That was a suggestion that they found, is that they need to research a structural violence framework so that they can look at physical activity. Other recommendations are to really have a restored and sustainable public-private sector family and community infrastructure. So Cami collected all this information and we're not doing anything with it. So we really need to find people who are passionate about and interested in this, and bring them together, public and private sector, and then also direct to public campaigns that draw the family in and let them know that their voices are heard. Once people know that there's a genuine interest in their care, it's that saying, people don't care what you know till they know that you care. When people find out that we are truly interested in healthcare and digging into the things that matter to them and providing them ethical and equitable care, they will respond. And then we need undeterred federal, state, and systems that will implement policies. So really systematically looking at what we have and changing the infrastructure so that the impact to the individual and the family, which overall impacts the community, that we are making the choices that's best for them, because it is best for us as a whole. Also, there were some states that use Medicaid, and they require them to screen for certain social needs. And if the patients trigger the screening as positive, then they would get referrals immediately. And they were finding that majority of states were actually doing this when they reviewed that program. So maybe we don't have some things great, but Medicaid itself, by having that, we're triggering some systems and we're screening people. We're preventing crisis situations. And then also educational initiatives that are helping patients understand options for care delivery and the different types of services available to them. There are studies that they've done where a lot of the aging population right now, some of them only have a 4th grade reading level because, 70 years ago, they weren't all finishing school. They were leaving and going to work and things of that nature, farming, or, family systems were different. And so we need to be having communication in language and terms that is easily understandable. It's important for their ability to make informed decisions and to give informed consent. And so having education initiatives that empower people to feel comfortable, to ask questions, to find out more about the care they're going to receive, so that ultimately they can make the best decisions that align with their own beliefs. And then, so in conclusion, healthcare accessibility and utilization remain ongoing issues for all individuals, but there is disproportionate experiences for low-income and high-crime communities. Low-income individuals are at an increased risk and have higher incidence of preventable health issues. And then in high crime, low income neighborhoods, there's a direct link between safe and reliable care, and that is impacting the environment that children are growing up in. Safe and sustainable and thoughtful care can be provided to all individuals, regardless of their economic status or where they live. And by taking that issue on and prioritizing equitable health care, it does lead to better trust in the healthcare system and better health for individuals overall. Thank you so much.